Hello, this is Dr. Gay from First Look MRI, and this is just a quick recap of the anatomy of the ankle and foot tendons here. So these can be scary if you don't read a lot of these at first to know what they are and where they go. So it's just a quick recap if you ever get flustered and want to have a quick reference. So we have 3 in the front, 3 in the medial side, 2 in the outer side, and here in the front we have the largest one is medial. This is the tibialis anterior or antiotibial tendon. It comes down and it attaches on the medial side. It has a variable attachment. Most of it attaches to the medial cuneiform bone, and some fibers may also go to the base of the first metatarsal. There's a variable attachment here. So this is the tibialis anterior. Now the next one over here is the extensor hallucis. The extensor hallucis muscle here ends near the ankle. Then we have the tendon coming down, and this goes to the great toe, which makes sense, extensor hallucis. You can see here we're going into the great toe right there. And then the next one over, we call this the extensor digitorum. And these are multiple. They go down to the toes. Here they are. 1, 2, 3, 4, 5. And underneath that we have the extensor digitorum brevis muscle. These are the extensor digitorum tendons here. And now we're going to go to the medial side. So we have 1, 2, 3 on the medial side. The main one here is the posterior tibial tendon. And just medial to that we see part of the spring ligament here. This patient has kind of a thick spring ligament, and the posterior tibial tendon will come down and attach on the navicular bone, medial navicular bone. In this patient, looks like they may have a prior strain right there at the attachment. You can see this better in other images, but this is the posterior tibial tendon. And now we have these 2 other ones next to each other. This is the flexor digitorum and the flexor hallucis. And we'll find that these switch. So here we're going to follow them down. They're getting closer and closer together, and now they're on top of each other. And where they cross over, this is called the knot of Henry. And now they're going to cross over each other and keep on going. Now this is the flexor hallucis. It's going to go to the great toe. And the flexor digitorum tendons are going to go to the 2nd through 5th toes. You can see them switch right across, switch places there. And finally we have the Peroneus brothers over here, Peroneus brevis in front. Remember that because Bruce Lee, B is in front, so Peroneus brevis is smaller, and it's in the front, and that will go down to attach to the base of the 5th. We can follow this down, 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 and there's the base of the 5th. And then the other one here, Peroneus longus, is posterior. The Peroneus longus, as it loops around the calcaneus here, oftentimes we'll have bright signal right here, which can be from an os perineum, or what they call a fibrocartilaginous node. It'll just have this foggy bright signal here, cartilaginous material, and it'll look for all the world like a tear or prominent tendinopathy, but you got to give it a pass if you see abnormal signal right in this region that loops around. And the Peroneus longus will loop underneath, and it'll shoot over here to the base of the first metatarsal bone. This one you can't see. Normally you can see it pretty well, but there's magic angle phenomenon, but it goes right across horizontally and attaches right over here. And that's that, the 3 medial, 3 anterior, and 2 lateral tendons.